Hello everyone. Continuing my series of Salute to the Heroes, Frontlines, fighting the coronavirus pandemic, we have been talking to many frontliners. Today I have with me infectious disease specialist Dr. Richa Tondon. Infectious disease specialist is instrumental in taking care of infections and infectious diseases. So coronavirus, when this pandemic hit America, I think infectious disease specialists became the frontliners, front fighters, they came at the forefront. We need them. We need to ask them what is going on, how it is when patients are admitted and they're fighting this virus. What are the symptoms? What to expect when you first start feeling the symptoms of this disease. We know now fever, runny nose, cold, congestion, shortness of breath. The biggest thing that we've been telling our patients, as well as that we have seen in the media, is shortness of breath because this virus affects your lungs. But there are other parts of the body, other organs that it has recently been shown that it has started affecting. And there are some treatments that are being used out there in different places, different hospitals, different countries. And some of these treatments have been helpful in very sick patients. But again, it depends on what other comorbidities the patient has, what other things are going on. There is a lot among there. In other news, we also heard about hydroxychloroquine and azithromycin in combination or separately being used for very sick patients, including some other treatments. But we also want to find out what happens to outpatients. Outpatients meaning not very sick patients, not severely ill. So they are not ill enough to go to the ER for us to send them to ER. These patients stay at home and they were told to stay at home and self-quarantine. So, they are at home separately in a room, separated from their family. That could be small children. So what to expect? What symptom to expect? What is the worsening? What is the duration of incubation? And what is the worsening? What day? Day 5 is the worst? Day 10 is the worst? What to expect? And in 14 days, should they start feeling better? If they don't start feeling better, what should they expect? What has been the length of average length of illness in people? So we will ask her all these questions. And then there are some other questions regarding antibody test, which is coming up, which will be very instrumental in, if it's available, in helping people get back to work. And that will be reopening America. That will be very, important for that. And the last, not the least question would be about the vaccine. So these are the questions we have for our infectious disease specialist. So we have her here with us.
Hello, everyone. So in my series of Salute to Heroes, we have been talking to a lot of frontliners, including doctors, nurses, ER physicians. And today we have with us in our studio, Dr. Richa Tondon. She is an infectious disease specialist, and she is going to be instrumental in telling us a lot more about this disease. Some we know, some we don't. So here's Dr. Richa Tondon. Hi, Dr. Tondon.
Hello.
So we have some questions for you today. You are the frontliners because this is an infectious disease. So you are in the forefront. So how is it out there? And, in patients when they get admitted to your hospital, what's going on there?
So we have quite a few patients coming in now. Every day we're getting quite a few. In the beginning of this is now about a month that it's been going on. We got our first patient and we'd been ruling out a lot of people before that, but that was our first patient. And, we have had a lot of experience since then. So most patients come in with a varying degree of illness. They get triaged at the ER. If they're not very sick, they don't have very high fevers, they can manage their illness at home, they are advised to just go home and do various things to keep themselves, to treat their disease at home. But the ones that get admitted are the ones that really we see on the floors, in our inpatient floors. And we have quite a few of them, and we divide them into different floors because we have some floors that are designated as COVID floors, and then some that are PUI floors because those are persons under investigation, and then some end up, unfortunately, in the ICU if they need to be intubated, which is basically a breathing tube that is put down in their throat to attach to the ventilator. So we've seen a wide spectrum of this disease. And
very sick patients basically go to ICU and then they need the ventilator, they need the support because this virus affects the lungs. What have you seen, where there is very severe illness, how long are they on ventilators?
So that's one thing we're finding, that they end up being on the ventilator, very stable, but on the ventilator for almost a week to more like 10 days for some patients.
So basically, as long as the body is fighting the virus, their lungs cannot function.
True. And it acts a little bit weirdly, the virus in the lungs causing, in some patients, ARDS, but most of them, they stay stable on the vent. It's not like they're requiring a lot of FiO2 or oxygen, but it just takes a long time for their body to recover their lung function to get back so that they can be extubated or the breathing tube taken out and sent to the floor. So we have quite a few patients in the ICU that are intubated, seeming to be remaining stable, not getting extremely sick, except requiring vent support for quite a long time. And then even once they come on the floor, then we've had a lot of success with many patients getting now discharged. So our first batch of patients that we saw, so that's really nice to see that they are
right. That's a positive thing.
So it takes a while, but they do recover.
So at this point, is your admission rate less than the discharge? Are more people getting discharged and you are seeing the flattening of the curve, less people getting admitted, or that hasn't? You still seeing admissions with COVID?
We are still seeing admissions coming in, but having said that, it seems like a steady flow. People are coming in, but some are getting discharged as well.
Are there younger patients too now? Because, initially it was like we were saying elderly people are more at risk.
We've had quite a lot of young people who were in their 40s who ended up requiring breathing tubes. We have some elderly as well who required breathing tubes, but somehow, we are seeing a lot of severe illness in our young people as well. And some of them have comorbidities like hypertension, diabetes, but there were a couple of them that did not have that.
Right. And people who have that, it makes them a little bit, more prone, and it's difficult for them to fight this infection. What about some of the treatments? Have you used anything? Like, we are hearing so much about hydroxychloroquine and azithromycin with, together in or with a combination or without the combination. And then, something about monoclonal antibodies as well. So would you please talk about that a little bit?
So for me, infectious disease, I always used to feel, I've been very humbled by this disease. All throughout, I used to tell my residents and fellows, you should do infectious disease. It's such a great field. It's just an infection. You can treat it. And yeah, it gets severe, but you can treat it. This disease has really humbled us all. Because yes, we have a couple of drugs. We are using hydroxychloroquine in combination, sometimes with azithromycin, not always, because the main drug is hydroxychloroquine. Azithro is just to decrease the inflammation. So it's not always required. And the combination we have to be very careful with because it can cause major side effects like increase in QTC and all of that. So in elderly patients, that's a concern. Having said that, yes, we are using it. However, the data is all anecdotal. We do not have any good randomized controlled studies supporting this. And that is a problem for us physicians who like to follow evidence-based medicine.
Right.
And there are studies going on in a lot of the big centers where they're doing randomized controlled studies, but that data is not going to be available till about fall at the earliest.
Later, right. So what about outpatients? Like, again, people question, like as a PCP, I get a lot of patients as they hear it on the news, and that's unfortunate that they heard it on the news, but then they ask that, can it be taken for prevention? And, just alone azithromycin, because a lot of people say, oh, you know what, I have symptoms of pneumonia, and now we are not doing x-rays, we are not seeing patients in the clinic, so they are all asking for a Z-Pack. So what do you think as an outpatient?
I would highly recommend that primary care physicians, who you keep saying are not on the front line, but there actually are. There are gatekeepers. They're the ones who are the frontline people, I would say, because they're, triaging patients over the phone, which is a very difficult thing to do for us physicians who are used to laying hands on patients and trying to look at them to figure out whether they need to go to the hospital or not. So it is tough because there's so much in the media and the news, but I can tell you, we are not finding that this hydroxychloroquine is a game changer or anything like that at all. And I would definitely not recommend that primary care physicians write prescriptions for Z-Pack or hydroxychloroquine at this time for
coronavirus. If they need a Z-Pack for different reason, that's different.
Right. For prophylaxis from coronavirus, instead they should refer the patients to different trials that are happening all over the US. There are a couple of trials that are happening in the US. Actually, I meant all over the world, but there are a few that are happening in the US. You can go to this website, clinicaltrials.gov. And
that's amazing information.
Yeah, so that has a list of PEP trials, so that's post-exposure trials, as well as PrEP trials, which are pre-exposure for patients who may be
Excellent.
infected.
That's
And even
amazing.
for healthcare workers, actually, who are interested, there are a couple of these trials going on. Because, you know, at this point, if we start giving hydroxychloroquine and Z-Pak is not going to do anything, but to patients, then we don't really know what's working. And these medications, all of them have side effects.
Yeah, side effects, and people can have false sense of security that now that they're taking this, they're less infected to others or, immune themselves.
And resistance development to azithromycin, which is always a concern when
Yeah.
you take any antibiotic.
Right. So for outpatients, again, because I am getting a lot of calls, and most of these people are not sick enough for me to send them. Well, 1 out of 10 might be, but most are not, and they are having mild symptoms, and we are saying stay home. So they have questions that after, sometimes even after 14 days, they're still symptomatic with shortness of breath. So what have you seen? Like, how long should they expect that they will be symptomatic?
So this is a very wide spectrum ranging disease of symptoms that we're seeing with this disease. And some people get only a mild fever, a cough, like just a mild flu-like illness, whereas others get more severely sick. So one thing we always advise patients to watch out for is difficulty breathing. So if a patient presents and they're being sent home, we tell them to hydrate, rest, try to exercise your lungs a little bit. So in the hospital, when a patient's admitted, we try to use an incentive spirometer, but at home, you can just take deep breaths and try to cough it all out. That's something to keep your lungs expanded. And it's better to take Tylenol as compared to something like Motrin, but that's controversial. But again, we're just advising, take Tylenol. Hydration is key, because otherwise you get dehydrated, you end up in the hospital. And then some people may require inhalers if they feel very short of breath, but that should be done in conjunction with the primary care physician, who would need to then see them. And that's why they've set up all these respiratory clinics where patients can go. But the important thing that I try to make sure that primary cares and us are telling patients are that this disease can worsen around the second week of your illness. So if you feel you're getting more hypoxic, which means more short of breath, then make sure you contact your provider to discuss the situation, because it can get worse pretty quickly. So that's something you don't want to ignore. But yes, even after recovery, let's say fevers are gone, the cough and fatigue may last for almost up to 14 days to maybe even more. I actually had a couple of colleagues now who have fallen sick. Fortunately not very sick, but one of them took care of himself at home, and he's a pulmonologist. So
wow.
he gave very good advice about how he used to just every hour on the hour, he would get up, he would do some lung exercises, breathing exercises, and he managed his illness without any medications, just with supportive treatment.
Oh, that's excellent. But, because he knows all about lungs. So, but there are people out there who get scared because it's been 14 days and they're still short of breath. So we have to advise that, it could be from the fatigue, which will last another 2 weeks. But is it for advice for patients who are quarantining themselves? Can they get out after 14 days and, mingle with their family, like people are stuck indoors and they have kids in the family or elderly? So is that still 14 days or has that changed?
So again, no data on that, unfortunately. So I cannot tell you anything definitively. However, we are advising healthcare workers who are coming back to work or patients that yes, for 14 days, mask and keep isolating after your illness has even got better. So, for healthcare workers, we're still asking them to mask. Now, all healthcare workers are universally masking, so that's different.
Yeah.
But the thinking is that definitely for 14 days, but honestly, we don't know. Could somebody be setting for a month? And
So if they stop coughing and sneezing, and hopefully they have a mask which they can wear around the other elderly or other people in the family, that would be very protective for others and for themselves. Okay. All right. So a few more questions about, going into the future. I don't know. It still looks like we are nowhere with this thing. So, what about the antibody test? How far are we, and what would that mean for reopening America or people going back to workplace?
So the antibody test would actually be very useful in identifying not acute infections, because it tests for antibodies that we make once we've had the infection. So it tests for IgM, IgG, primarily IgG, and that would help figure out who got the disease, who is now perhaps immune, especially if we have the titers, who is immune to the disease. and perhaps can be safely incorporated back into society to go back to work, for healthcare workers, to come back to work, that sort of thing. So I think it'll be useful there. There are
Do we know how long the immunity will last once a person has it?
Yet. And there have been some cases of reinfection in South Korea. Some reports have come out from that. So that's a concern. So again, a lot is unknown. So I don't think we should drop our guard. Like, let's say a patient has had corona, they should not be under the impression that they cannot get it again, because we just don't know what the true situation is. And they should still continue to do everything we're advising, which is social distancing, stay home, because you're saving lives by staying home. So stay home, wash your hands, don't touch your face, that sort of thing.
All right. So people should keep doing what they're doing. It's helping.
Yes. And the antibody test, ultimately, if we do get one for to test another kind, like a neutralizing antibody, then all these patients who've had coronavirus may actually become the treatment, because we could get convalescent plasma from them to treat our current patients, our patients who are now, getting this.
Yeah, I heard about that. Some places, saying that they used, I don't know, maybe some news coming from India or maybe some other country, that they used it, and one or two patients may have actually, responded to it.
So I know of two studies that I know of. One was, and I forget where, they're from China, Italy. That's where most of the studies are coming out from now, because they've used this a bit. And there's two studies. So one is with 5 patients, the other is with 10 patients. So again, small studies, showing that perhaps it is effective. So we are trying to set up a study for that in our hospital as well. And I know MGH
That's great.
Are trying, and I think the studies are probably already ongoing in New York.
So this is plasma for persons who have been infected in the past and then they got better, so they have the antibodies. So we are basically using those antibodies to fight in a newly infected person. And is that what something happened with some other disease like Ebola in the past?
Exactly, yes. So that has been studied for many diseases like Ebola, MERS-CoV, SARS-CoV, that happened before a couple of years back. So it has been studied and it has been found to be effective in some of them, which is why we're exploring that option for this disease as well.
And what about a vaccine, which is, we hear 12 months, maybe 18 months. So eventually it'll happen, but we don't know. It won't happen soon enough.
I don't think it's going to happen anytime soon, because the problem with vaccine is that it has to go through the 3-phase trial. There's a lot of issues with safety. We have to make sure it is efficacious first, and then its safety profile, because this is something where, they're manufacturing to use in public. So in the general public, large quantities have to make sure it's safe for the elderly, for all age groups, for elderly, for children, for immunocompromised patients. So even with a few shortcuts here and there, I don't know, 12 to 18 months seems a little bit...
We're jumping the gun and saying 12 to 18 months, it may not happen. It's just to keep
Dr.
some hope out there, it's
Dr.
probably
who's the expert, said that possibly, so we hope so, but it would still not be for this pandemic at this time that we're facing.
All right. So excellent professional opinions. Thank you for that, Dr. Tondon. But I also want a small, we'll talk about your message to the community, because some people are getting stir crazy and people are getting, we're stuck indoors and they're saying it's enough of it and not understanding the depth of the problem. So we will ask you to give us a small tip or a message for the community out there. But on a personal front, you are going out there into the hospital where positive patients are admitted, and you're gearing up every day. And do you have enough gear? And then you're fighting this invisible enemy, and then you're coming home to take care of your children?
Yeah, so that's a great question, because I think a lot of us are in that situation. And what I've started doing is, earlier I was going in my home clothes and then coming home, and we had this designated area where, like a guest bathroom where I would go shower, but it was just getting a lot. So now I just go to the hospital, change into scrubs, see the patients, gear up, do everything, and then leave all the scrubs, everything in the trunk of my car, and change back into home clothes and come, just so that it's a little bit easier. But I do have 2 elementary school going kids, so I want to be careful. I have a husband who has asthma, so we just want to be careful and keep everybody healthy. So that's what I think my message is. A lot of people, and I too felt that, oh, this homeschooling, okay, we have to do it, we got to make sure. But I think in the long scheme of things, what we need, I'm hoping that on a personal front, we come out of this healthy, safe, and the kids, they'll be fine if they don't learn, because they're learning other things. They're learning so much else.
Going through a thing like this.
Okay, I cannot do math with you, but hey, I can teach you how to do laundry. So come on, let's do laundry together.
Yeah.
So I think we have to pick our battles, and right now the main thing we all have to do is stay home, socially distance, just keep your family sanity, and make sure your children feel loved and safe, and wash your hands.
Safety is important. Kids
wash
will.
Your hands. My kindergartner will teach you.
Absolutely, safety is very important, and learning will come. It will happen, and I think kids are great at catching up. They'll catch up whenever the schools reopen. So thank you very much for being with us. It was amazing talking to you, and hopefully you stay safe and keep doing the good work. And the tagline of this is salute the heroes. Superheroes don't always wear capes. Sometimes they wear scrubs, and you are one of them.
Oh, thank you so much for having me. This was lovely. Thank you.
Take care. Bye.
You too. Stay safe. Bye.